Pattern differentiation, foundations of TCM diagnosis. To understand TCM pattern discrimination, it is crucial to review some basic concepts and theoretical underpinnings of Chinese medical theory. TCM theory is characterized by a peculiar approach to diagnosis and treatment that applies a series of flexible individualized parameters based on a naturalistic integrative view. TCM does not use complicated or aggressive procedures to confirm a diagnosis, instead relying mainly on the careful analysis and interpretation of information obtained through various forms of patient observation. One of the basic theoretical pillars that supports the TCM system is the concept of the body as an integrated unity or whole body system. According to this view, all external expressions of the condition of the body are observed and compared with external environment and then analyzed systematically to explain what is occurring inside the body of the patient. TCM diagnosis and the black box model. The TCM diagnostic model could well be likened to the so-called black box model, which seeks to determine the contents of the black box without opening it, through the application of external stimuli and appreciation of external reactions. Following this analogy, the body is a black box and what is going on inside is determined, example, diagnosed, through what comes out of the box. The signs and symptoms, pulse and tongue images, facial expression, feces, etc. The salient feature of this model is that it preserves the integrity of the whole system. This concept is expressed in the chapter, The Foundation of the Organs, in the Neijing, one of the older sources of Chinese medical theory, specifically in the following expressions. All what is in the inside reflects on the outside, and the inspection of the exterior lets you determine the state of the internal organs. Then you can know what kind of disease affects the patient. The holistic or integral concept of TCM. The concept of holism in TCM has two aspects. The body as an integrated whole in the unity of man and nature. TCM views the human body as an organic whole. Although the body is composed of various tissues, all parts and functions of the body, organs, channels, vital substances, etc., are always connected to each other, functioning as a unity. Furthermore, the human being is an active part of the whole universe. On one hand, the natural world constantly influences the body, and on the other hand, the body adapts to conform to variations in the natural environment. No part of the whole is isolated. All are mutually related. Therefore, when there is a disturbance in one region, sooner or later it will affect other parts of the whole. According to TCM, the disruptions caused to the adaptation processes of the organism by those disturbances are the origin of disease. The 5 phases and the organic energetic systems. The 5-phase system is another theoretical construct of classical Chinese naturalistic thought that reflects the holistic concept when applied to TCM. This system establishes functional correspondences between various natural phenomena under the main categories of the 5 phases. These are water, wood, fire, metal, and water. 5-phase theory applied to TCM recognizes 5 main depots. The most important organs in the body, namely lung, liver, heart, spleen, and kidney, and the rest of the tissues of the body, which are structures, internal organs, sense orifices, emotions, and the spiritual or mental functions, are organized into systems under the aegis of these Zhang organs, each of which is linked to one of these 5 phases by virtue of their functional relationship, as we can see in table 3.1. This system of relationships extend to pathology and treatment. When one component of one of the organ system is diseased, the disease is said to pertain or to be the province of the corresponding organ. Acupuncture points are in turn associated with each of the Zhang organs and can be chosen to treat disorders affecting their associated tissues or body structures. For example, a disease affecting the bones could be treated using acupuncture points on the kidney channel. Moreover, diseases in one part of these organ systems are frequently seen to affect its other parts. In our example, the patient may also report discomfort in the ears and lack of willpower to act. So in this table, we see the organic energetic system, the 5 levels, and the 5-element system. In the 5 levels, we have the body structure, organ, sense organ, emotion, spiritual mental activity. And in the 5-element system, we have water, wood, fire, earth, and metal. In body structure, bones pertain to water, sinews to wood, vessels to fire, muscles to earth, and skin to metal. In the organ, kidneys pertain to water, liver to wood, heart to fire, spleen, earth, lungs, metal. In the sense organ, the ears is to water, eyes to wood, tongue to fire, mouth to earth, body, hair to metal. In the emotion, fear is water, anger is to wood, joy is to fire, thoughtfulness to earth, and melancholy, metal. In the spiritual mental activity, will is to water, courage is to wood, ideation is to fire, consciousness is to earth, and instinct is to metal. The holistic approach of TCM diagnosis and practice. TCM stresses the need for a holistic approach to treating illness. Patients are not divided into parts, where every condition is localized and diagnosed separately, with a specialist required to deal with each part and individual condition and treatments that may frequently be at odds with each other. Chinese medical thoughts call for a therapeutic strategy that keeps sight of the patient's overall health, addressing all symptoms and complaints as part of one disease process. This produces faster, superior, and more appreciable effects for patients. Individualized diagnosis. Individualized diagnosis and treatment constitute an important principle of TCM. In the practice of Chinese medicine, diagnosis and treatment are always performed with the patient's age, gender, constitution, and lifestyle in mind, as well as the presentation and evolution of disease. The dynamic balance between health and disease. Classical Chinese thought holds that all phenomena in the universe are moving and changing constantly, continuously. This is true in TCM, where the physiological phenomena of the human body are perceived to be a process of constant transformation and interaction. Normal physiological and pathological conditions are a pattern of continuous flux. It is this dynamic balance that maintains health, and disease is seen as a deviation from the correct evolution of this pattern. Diagnosis adjusts to the dynamic process of disease. It follows then that disease is not a static picture in the system. TCM regards disease as a dynamic process, continuously changing and adjusting to the environmental, dietary, emotional, and other factors attendant to the situation of the patient. Thus, diagnosis and treatment need to be continuously adjusted to the evolution of the disease dynamic for each individual patient. Thank you for listening.